And it really looks like to me that hydroxychloroquine, which we've used for how many years? 50 years?
Yeah, for malaria and some other ailments, but mostly that.
Here's where we're a little confused. We will see two people sit down with what apparently seems to be the same credentials, okay? and they will, one will tell us one thing and the other will tell us the other, and both of them seem to be equally capable of giving us an answer. Does that confuse you, Bubba, as much as it does me?
Oh, yeah. It's Rick, you know me because I don't worship science, but I do love science.
Yeah,
and I feel like it's an expression of God's creation. And it aggravates me to no end when the science becomes a moving target.
Yes. So now.
And I understand we don't have all the answers to begin with. I mean, science is like you cut down a log in the forest. I mean, it takes a long time before it's a table.
That's right.
You know, and there's processes. But we got to at least keep moving the wood down the line. You
And,
know what I mean?
and we also have not been afraid to answer. Does it make a noise when it fell? Yes. All right, so let me say this again, okay? Listen to this headline, because this headline does not help. It does not help, because this comes from the very conservative USA Today. Listen to this headline. Hydroxychloroquine, FDA, and then semicolon, FDA pulls emergency use of malaria drug touted by Trump to treat coronavirus. Now, there's no need to say touted by Trump.
What does it matter?
Well, there's the key.
It shouldn't.
There's the key.
That makes you skeptical.
You need to scratch that out and just give me the facts.
Oh, yeah.
Give me the facts. It's a dog whistle, Rick. That's exactly what it is.
Why in the world would you?
Dog whistle.
If we're sitting here and we're the citizens of a country that's fighting COVID-19, and as the rest of the world has to some degree, and then some to a larger degree. And all we need to know is, do any of these drugs help people that get sick? But they have to add touted by Trump to treat coronavirus.
Exactly.
See,
that matters. What does that matter?
That shouldn't even. You know what it should say? It should say update on hydroxychloroquine. FDA has pulled the emergency use of the malaria drug,
citing that they think that the risk outweigh the benefits when treating COVID-19, which is not what it was designed to be used for.
People
anyway.
take it daily and they're fine.
And the whole point, back to Trump again, we used to understand the expression take a half-court shot, okay? If you're about to lose the game,
right,
and there's no way you can get down, and Rick, you're down by two points, and a three-point shot will win the game.
Yeah.
But you can't get the three-point shot you want, and the clock is running out. I'm at 1 second. Turn and throw the ball over your head. Who knows? It might go in.
We also
it was a if you just take a long shot, okay, because it was the only thing out there that had been around for a while that had a kind of an antiviral component to it. And I don't know if it works or not. I do know this: we had several people who looked like they were on death's door and took it and got better. It was well documented, but they're saying in the studies that it doesn't look like it does it. Well, that's fine. That's no slam against Trump.
Yeah, it shouldn't be in the headline. Just like you said, that makes
it's
you
not
skeptical.
good for Trump. Yeah. It's not bad for Trump. He just said take a long shot. Y'all, we were in a full panic a few months ago. The country was shut down. The world was shut down. That's all we had.
Right. Well, this is what I don't understand. In the other version of that, as we call the Hail Mary, just throw one to the end zone.
That's it. It's a Hail Mary.
And see if somebody comes down with it.
Of course, then the conspiracy, the big farm, they ain't going to make no money off of it.
Big
because
farm.
It's been around. It's cheap.
That's right.
Well, Greg, I'm listening to their own language to that point. And we're not conspiracy,
And that's just a theory.
But, Greg, listen, we know for a fact, because, having people who have struggled with things that hydroxychloroquine is used for. Well, if this list of common side effects, I love the word common, of the malaria drug, I've taken it for malaria myself, didn't have any of these problems. But if they say there's a list of common side effects, nausea, vomiting, stomach pain, cramps, loss of appetite, weight loss, diarrhea,
that's everything you take.
Dizziness, spinning sensation, headache, ringing in the ears, nervousness, irritability, skin rash, itching, or hair loss, are all the people who've been on it for years, are they having all those things?
Rick,
or is it regular?
any drug you get has that same list.
Yeah,
have you ever noticed it?
If they have
Listen to the commercials
any
for
response
drugs.
to those, they have to list it. That doesn't. I mean, what does it say? You may. I mean, that's all this is.
But you're right.
Legal
People take
mumbo
it
jumbo.
daily for lupus. People take it for malaria. People, now are they saying when you mix the Z-Pack with it, that makes it have more side effects? Did it say that?
It's not saying that. It says
because there's people who take just the big long word you just said, hydro, blah, 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 blah. Right. They take it daily.
But,
have for years without any side effects.
If you want to come out and say we've done the scientific testing,
those are no different side effects than any other drug you hear.
Well, here's the thing: are they going to tell
maybe
us,
less bloody stool?
Are they going to tell us the side effects of the rush to market vaccine they're coming up with?
Exactly. It'll at least be that long.
Are we going to get the side effects of that, including Mark of the Beast?
I mean, these commercials on TV kill me. They show people out riding bicycles, having a great time. At the end, they go, may cause diarrhea, and you're like, whoa, wow.
What
guy wouldn't be riding a bike if he had all that.
Yeah, Rick, you want me to tell you the side effects to aspirin, the possible side effects? Nausea, vomiting, stomach pain, cramps, loss of appetite, weight loss, diarrhea, dizziness, spinning sensation, headaches, ringing of the ears, nervousness, irritability, skin rash, itching, or hair loss. Okay,
that seems to be the running theme, doesn't it?
What would you do if in the list of the vaccine you heard this could cause them the insult plus the fact you've taken the mark of the beast? What did he say? Because he went at the number 666. And of course you could have just
patent number 666.
Right. Be aware, coming up soon, someone will declare world peace. That person like the Antichrist. So that's
Rick. Would you take the vaccine today if it came out? Would you take it if all of your irrigation, lumigation, all those issues could be resolved?
Lumigation.
Lumination.
What
is that?
Lumigation is actually when you light your pipe.
Irrigation, lumination.
That may be what's happening.
Sorry about that.
Are you saying if all of a sudden
it's all gone?
I'll go back to everything's working exactly the way it should? I'll take it today. At 2 p.m.
Rick, I'm with you on that.
Because I know that's going to make my life miserable. The vaccine may not. You know, I mean,
I got a shot.
And I'll be honest with you, that way, see, if, you know.
Yeah.
So we'll, top of the hour. If you leave us, have a good day. Thank you for being with us. So there's the bizarre COVID-19 update as we continue to try to figure all this out. Don't know why Trump's mentioned, and that's irrelevant. We have a couple of callers off last hour. This is when the USA Today wanted us to know the FDA is removing hydroxychloroquine as a treatment of COVID-19. Of course, they want us to know this is the drug that Trump touted. I don't know why they want us to know that. But Matt in Montgomery undoubtedly is a pharmacist and wanted to give us a little update from his view of expertise. Matt, hello.
Matt.
Hello. Hey, Rick and Bubba, Green Acres.
Glad
thank
you're
you,
working,
sir.
buddy. Yeah. So
somebody's got to pay down on that deficit.
Absolutely. So, yeah, I mean, it's crazy, this whole thing. I've done healthcare policy for almost 20 years. The issue is we have an evidence-based database, and I just looked it up. 48 states have off-label use laws, so it really doesn't matter what the FDA says.
Yeah, the
doctor
can prescribe it, right? Whatever they want to do.
I know you're not a doctor, but you are a pharmacist. Do you think there's any, and you know these conspiracies start, and do you think there is any truth or could be truth to there may be a reason that hydroxychloroquine gets demonized because it's been around so long, and there could be some drug companies that are saying, hey, this doesn't have much of a return on it. It's been around for so long. We need to come up with the latest, greatest, newest thing.
Are you calling Big Pharma? Right?
I'm talking Big Pharma, which I'm thankful that pharma's out there because
I like it being big.
And of course, socialized medicine will, of course,
opposed to little pharma.
We'll do away with research and development, and then we'll all go back to the dark ages. But sure. So, do you think there's any truth to that? Why do you think it's being demonized like it is? Could it be true that we've done what we should do and just said we don't think it delivers what it needs to, and the risk outweigh the gain? Doesn't seem like that is apparent. But
what do you think, Matt?
Yeah, so I mean, if you really look at the drug and everything is being, it's being demonized, one, because it's political, 100%.
Okay.
I mean, we have letters that come in as pharmacists, physicians. I talk to physicians. I know physicians that are working in hospitals right now that are taking it, just as preventive. It's kind of like Tamiflu during flu season. They take it.
Yeah. And Matt, isn't this because there's just an absence of anything better? I mean, this is the only thing we got right now.
Yeah, and I don't think the data is out there. I mean, technically, the FDA, to approve a drug and even to make different label changes, most of the studies have to be done in the United States. We just don't have that much data. It's all coming out of the WHO and everything on it. So,
yeah, it's like
it's kind of like.
Go ahead, Matt.
No, it's kind of like one of the first AIDS drugs that we found worked for HIV and everything was because it was used for leprosy back in the 70s.
Correct. So I'm looking at this story. I tried to find, because Bubba said rightfully so, if they've done the testing and they've come up with that really have, but that doesn't tell you in this story, and maybe it's left out in all fairness, but it never tells you what study they did in order to show that the risk outweigh the gains. It doesn't show how they scientifically tested that and have come to the conclusion, and maybe it's just left out in the story. It really doesn't. It just tells us that China had been doing some studies that we didn't feel like met the standard of the double-blind, randomized, placebo-controlled trial, but it doesn't tell us that the United States ever did the gold standard double-blind, randomized, placebo-controlled trial. It just says it would show us more. It doesn't say we did it. Maybe we did. It's just left out of the story.
You talk to your physician every couple of weeks or whatever, and she's right. We don't have enough data to say yes or no right now. I mean, I would never do harm to a patient by giving them a drug. So it's like, or dispensing a drug that I believe that will harm them. I mean, that's my duty. So it's like, but this one, we always use the thing, would you give it to your mother if she was sick? I'd be absolutely yes. Because there's enough data to disprove it without, having heart issues.
Matt, here's the thing. I agree with you. I know several doctors that are taking it just because that's the only chance they have to protect themselves right now. But this is what I thought was strange. The World Health Organization was doing a clinical study on this, and they ended the study saying that it was just too dangerous. It was just too dangerous. They couldn't even get through the study, which I thought that was very odd because we have been using this medicine for 40 years.
Yeah,
that's the same organization Trump says we're going to stop funding.
And there's some higher risk to using it. There's a higher risk to using aspirin. We know that. Oh, yeah. But yet they still give it to everybody who's going into areas of the world where malaria could be an issue. I mean, they pass it out regularly. I mean, it's not that rare at all. So I just found it strange. Look, if they'd have come back and said, look, we did this, a few people got better, a few didn't, we really don't see any good in it, I buy that. But the fact they stopped it saying it was too dangerous, to me, looks like it was a political move.
Right, and that goes back to what I said. It never tells us that we completed the gold standard. We said, well, China didn't have the gold standard. The gold standard would tell us more, and then we quit on it before even finishing? I mean, that doesn't make any sense.
They haven't outlawed it for people with malaria or going to areas with malaria or lupus. or various other arthritis issues.
There's another one, lupus and something else. I can't remember what.
And lupus is the most I'm common with. I've had people on this for, I'd say, 10 years with lupus. I mean, that's the most common when they use it for. So you're absolutely right on what you're thinking.
Well, it's almost like when we get into something like
I'm not a doctor, Matt. I just play one on the radio.
See, we get in on COVID-19, and this is where I get real confused, okay? The same people that tell me that I need to be gravely concerned about COVID-19 tell me that COVID-19 is safer than hydroxychloroquine. Would you say that to a lupus patient?
No, absolutely not.
You wouldn't. So is COVID dangerous or not? Yeah. Because if you say that hydroxychloroquine, 50 years we've been giving this to patients, is more dangerous to me than any benefit it could do in my fight against COVID-19.
Then what are we giving it out?
Either COVID-19 isn't as big a deal as y'all made it out to be, or it's more dangerous. It's more dangerous than you ever said it was.
It's almost like, Matt, there's an agenda. Right. And when they run into a problem where they're about to be proven wrong, they have to flip the script and change the argument.
Yeah.
Or cancel it and not come out with any data.
Right.
And I also am paying attention to when we had the peak, the apex of the protest, sadly then, which was hijacked by anarchists and rioters and looters, when that was at its apex, I couldn't get anybody to even talk about COVID-19.
No.
Yeah. And then now
10 days ago, you couldn't find it in the headline.
Now that's settled back down, strangely, COVID-19 has come back. It's trying to move its way back into the dominant story. And that doesn't help because if gatherings were going to be the end of time,
virus doesn't care what the cause is, if it's good, bad, or otherwise.
COVID-19 doesn't know why you're all grouped together. It has no idea.
No.
Are you here for a ball game? Are you here for a protest? What are you here for?
Yep.
It doesn't know.